people get along very nice. The reason that we have a degeneration of any disc is due to the fact that the vertebra does not set level on that disc. First, we'll have a ballooning of the disc. It's the ballooning aspect of that disc that causes the nerve pressure. It's not the compressed area. It's the ballooning or the thick part of the disc that produces our nerve pressure. And when you examine some of these cases and you come along with a true subluxation, and you see, well, the pressure's on the opposite side, or on the low side of the vertebra instead of on the balloon or the high side. And when you run into this situation in the lumbar or anywhere where the pressure is on the thin side of the disc, it indicates that we have gone from acute condition into the chronic. It has gone into the paralysis condition, and you get a cold reading instead of a hot reading. You get a cold spot on your nerve instrumentation instead of a hot one. And these cold spots indicate that you've gone from a live tissue into a dying tissue. It's gone into the paralysis state. If it's a fifth lumbar, for instance, he's gone into a sleepy, numb feeling of the whole leg, muscle atrophy of that leg. And you'll have a cold spot. But as soon as you get the pressure off of that nerve sufficiently, which is slower, of course, than the acute. Sometimes it'll take you 7-8 weeks after the pressure has been reduced before that reading will change from a cold back over to the hot. And then, you see now, if you got an atrophy of the left nerve on the left side, for instance, see? If we got an atrophy on the left side, we'd expect to find the nerve reading on that left side. But it's a cold reading. It goes on the opposite, it goes on that side instead of the other side. But anyhow, it'll take at least 8 weeks before nature can repair the damage after you have corrected the nerve pressure. And then that reading will reverse itself, come back to the paralyzed and cold spot. And whenever you get these cold spots with your instrumentation, you must take them just as serious as your hot spots. It indicates that it's a degenerative process instead of an acute hot process. And we have them all along the spine. Especially more so around the lower lumbar, fourth and fifth lumbar, and the fifth, sixth, and seventh cervical. That seems to be our areas where we run into paralysis, numbness of the hands, for instance, degeneration of the sixth and seventh intervertebral disc due to whiplash. That vertebra has slipped back and down, causing degeneration of these discs, which has not been understood by the average chiropractor, due to the fact that we have not taken enough lateral x-rays. A lateral x-ray is a must. We must take a lateral full spine of every patient and view these discs, and you'll be surprised how many of these degenerative discs that you're going to find. And another thing, you're going to be so surprised to find how many kyphotic necks that we've gotten amongst our people, and especially amongst our chiropractors. You know, we have an awful hard time to find a chiropractor that's got a normal anterior cervical spine. The layman isn't quite as bad, but with our fast-traveling age, I've noticed in the last 20 years that we have more kyphotic cervical spines than we did 20 years ago, due to the fact that we have many more whiplashes. People are stopping at stop signs, and somebody will come back and hang them from the back and whiplash their neck. And when they get a whiplash like that, that's conductive of these kyphotic spines. It throws out one of the lower cervicals. It slips posterior. The cervical slips posterior and inferior. And then it starts wearing the disc down like that, see? Causes a degeneration down the line. First it'll be puffed up thick like that, and then it starts degeneration. And what the chiropractor has to do then is to get a hold of the spinous process and set that up onto the disc so it's level. And that's why we come up with the cervical stool. It's the only way that we can correct a posterior-inferior subluxation. We cannot correct it lying down on the table. That's where what we've been doing in the past years, is lay our patient back on the high-low and try to correct a cervical subluxation. You can correct the laterality of a cervical, in which we do find occasionally the axis and occasionally the third. But as far as 4, 5, 6, and 7, we seldom have any laterality in the cervical area. You can adjust the 5th, 6th, and 7th cervical usually from either side because there's no laterality. It does not rotate either right or left. It's more of a compensatory center, and you can adjust it from either side. But it does go posterior, inferior from all these whiplash accidents that we do have. So therefore we came up with the cervical stool and just these in the sitting position. It's the only way we can adjust or correct or set is a posterior inferior subluxation. We can also do a pretty good job until you people have been trained and can set these particular vertebrae from the inferior to the superior and anterior. You can do a pretty good job by laying your patient on the stomach in a prone position, on your high-low or on the knee chest, and getting your contact on the 5th, 6th, or 7th cervical and adjust it from inferior to superior. That you can also teach them to do that particular type of technique until they do get onto our way of correcting it, because it does take the chiropractor some time to acquire the art in setting these cervicals in the sitting position. And it also requires quite a bit of art to palpate the cervical region in that position, in the laying back position. You've got to be able to palpate those cervicals. They're so close together. They lay right up close. And boy, you can palpate them. You've got to palpate them to know. But they're real close. So many times you can just get the tip of your finger to get a hold of the spinous process. And before you do give an adjustment, before I ever give an adjustment, I have the A to P and the lateral X-ray. I want to get the characteristics of that spinous process. I want to know just every little detail of that spinous, so I know just where to get a hold of it. It's just the same thing if I'm going to adjust a upper dorsal, second or third dorsal. I'm going to have my X-ray up there so I know just exactly if it's a PRI where you have to get on the left transverse, for instance. I'm going to see just the formation of that transverse. I know just where I can pick it up across from the spinous process of number 1 dorsal. Those things you have to be so careful so that you get your right contact on that vertebra in the right way and get your right line of correction to make that settlement. So many times we can have the right subluxation, the right listing, but again your contact may not be just right. Your line of correction may not be just right. And you give several adjustments that are not correcting that particular vertebra. You're just spinning your props trying to correct it. But I like to have it right the first time. I never give an adjustment unless I'm real sure that it's the right vertebra in the right direction and that my contact is on the right spot of that vertebra. Chiropractic is not easy. It's a scientific science. In order to get these things right, it's got to be done so right. And none of us can be careful enough. The trouble with our scientific approach that we have, too many of the chiropractors don't like to put themselves out to really study enough to understand these mechanics the way they should. But if we're going to survive as the chiropractic profession, and each one understand enough of this to bring forth unity amongst our profession, we have all got to get down and really study and understand these pelvic and spinal mechanics. It's so wonderful when you understand it, and when you get to understand this, it all folds into your way of thinking. When you get our work and see how it works, you've been thinking about those things in the past. It's nothing new to any of you when you really understand our work. It really folds in and you say, well, now, why didn't I see that before? Why haven't we had this work before? Well, nobody come up with it up till now, and that's why I've been anxious to build up the buildings up there so that we could give it to the profession. Otherwise, if we would not give it to the profession, it might take another 100 years before another individual will come up with what we're giving you today. This work today is really scientific, and we're depending on this particular group right here today to take this earnestly, start upgrading your knowledge along this scientific chiropractic approach, and if we can have a nucleus like we have here today and get your neighbors to understand so they can upgrade their knowledge, because too many of your neighbors are not chiropractors. They're manipulators. They manipulate from the top down and then from the down up again. They're just cracking bones. making them crack. They're not correcting anything. They're not reducing nerve pressure. Lots of them are doing more harm than good. A lot of times these chiropractors that are manipulating are just cracking the facets. It's just a shotgun method, goes root all the way up. They adjust everything. They adjust the cervical region from the right and then to the left, see, just to make it crack. That's not producing any reduction of nerve pressure. Now, lots of times they're whiplashing that particular area, making patients worse. But the favorable part to that chiropractor, the patient doesn't get worse immediately. It might take a year after that particular adjustment is given before he gets sick. And by that time, he's forgot about the chiropractor. He's back into the medical man's hands. But a lot of these adjustments are very destructive, which I wouldn't like to see in any other audience. But with us here, we must face those facts. We must face the facts to be sure we have the right vertebra in the right direction and correct that vertebra back to its normal position and stop the destruction of that disc, which is undergoing destruction day by day, month by month. These are not fast processes. We have cases come into us. I had a complete dislocated of the sixth cervical. It took 6 years for that patient to develop a symptom from a complete dislocation. Just think of that. Complete dislocation, where it just unhooked from the facets, just the opposite side.